Welcome to the Wellness Check segment from Elevate Medical with yours truly, Dr. Kwame, and I'm here with Victor Francis joining me from Fortress Fitness, and today we are discussing the common myths of high blood pressure.
So, Doc, right. So, what are some of the common myths on high blood pressure? I've heard a lot. So, you really had to enlighten me with some of the myths that have been set out there.
Yes. Well, for starters, we pick it up right off the bat. One common one is this. Have you ever heard it? I feel fine, so there's no way my blood pressure can be high.
Yeah, because...
Heard that before?
Yes, I heard it, and, I think it... I mean, I just want to jump on men, but I know we slow to react, we as men, but I've heard that before. I'm okay, just slight headache, took to aspirin. One of the biggest myths with high blood pressure, as you mentioned, Doc, I feel okay.
Yes.
I feel okay. So, what is in that? How dangerous is that? To know that, hey, I feel okay, just slight headache, So, you gotta give me some enlightenment with that.
Well, there's a reason why hypertension or high blood pressure is known as the silent killer. That is one reason. Because most times, most patients will present at the late half. And this is where they develop symptoms only when serious complications have been occurring. So they will come to us with damage due to the kidneys, they will have damage to the heart, and other major organs that are affected by high blood pressure, even the eyes. So the silent killer comes in again that term from being a very slow progressing disease. However, in a lot of patients, they do not present with common symptoms or some of the most common complications until much late in the disease process. So we don't have a lot of patients coming in early to get a regular screening and regular checks. Some people don't even check their blood pressure until they end up in the hospital. So this is a common thing. So because it is termed as a silent killer, hence the reason why we advise persons to conduct regular physical checks, regular comprehensive medicals, in order to really see what is going on with the blood pressure.
But once you said that the high blood pressure, the silent killer as we call it, affects the kidneys, the heart, and things like that down the road. But I think there's also myth on how one develops high blood pressure, right? Is the jury out with that? I don't know what, because in the 20s and in the 30s, I think you don't have, that don't really show up. It's only when you're going down over 40s and things like that. So what is the narrative, the myth on that when coming to starting to suffer with high blood pressure?
Well, that brings me to myth number 2. Yes, thank you very much. So that steps in where you hear patients say, I'm young and blood pressure only affects older people. This is very common. However, a lot of times high blood pressure shows up in teenagers. It can show up in children because hypertension has various causes, various elements that contribute to it. So it's not just to say if your father was diagnosed with high blood pressure, you might be predisposed. Genetics is only one factor. But common issues such as obesity, stress-related causes, kidney disease, which many persons suffer with, which in turn cause them to have high blood pressure, in addition to lifestyle diseases and common lifestyle indicators such as a healthy diet, exercise, and even social issues such as smoking, alcohol. All of these components contribute to high blood pressure. So exposure to these things and these elements and mismanagement of these elements are common factors why a younger person will develop high blood pressure, apart from genetics. So there is multifactorial, and hence the reason why we see patients even in their teens, 20s, 30s, 40s, suffering with hypertension as well. So it's key to get checked.
Yeah, well, I think everything boils down to getting checked, right? And I think headaches, is it true headaches is an indicator of, continuous headaches is an indicator of that the pressure is elevated?
Yes.
True. But as you mentioned, some of the cause there, we live in Trinidad and the culture is drinking.
Yes.
Right? And so I guess it's drinking, stress, dealing with, those kind of things. So I guess every household has somebody suffering with high blood pressure because life itself, right? So I guess that's why it's important to check, right? And when coming to diet and, eating properly, that's a challenge out there because we don't have no guide. What are the things or so many foods that can contribute to elevating your blood pressure?
Exactly. And that also ties in beautifully to another point. Some people will come to me and they will say, well, Doc, I only consume, for example, as we're speaking about diet, Himalayan salt or pink salt. And that is the better option. But what I like to educate patients on is that salt component is not necessarily the salt itself, it's the quantity and frequency of exposure. Because all of those salts and the various kinds, from black to pink, will contain the common ingredient that is key in elevating your blood pressure. So it's not necessarily the quality per se, but a lot of times it's the quantity. So exposure and education concerning dietary habits is critical for patients. And that is just one element. The overconsumption of fried foods, fats and oils, all of these things, even in home cooking. People think, well, you could only elevate your bad cholesterol by eating out, but that's not the case. utilizing common household items and common household ingredients in excess as well can contribute to that as well.
Well, when you mentioned pink Himalayan salt, that's what I use. So I recently hear you say, well, right, but I just use it in big quantity.
Yeah,
moderation. Right? Moderation. And I think,
yes.
One of the things that I encourage people out there when coming to like changing the diet is just moderation.
Yeah.
Because first thing people is telling me, Vic, gosh, as a trainee, as he this, as he that, but it's in moderation, right? Because the foods out there, the fried foods, the drinks, those who just smoke and things like that. Right. I do believe life is about a balance, but I think if you regularly check your doctor, I think whether you smoke or don't smoke, drink or don't drink, I think you can have a gauge of where health is and how you can progress going forward. What do you think?
I completely agree with that. Regular consultation and having that health check and really letting your physician analyze all of the factors that contribute to you, because those factors, although they are general, depending on your lifestyle, you will be more predisposed to certain elements than others. But to speak to that, another common issue that we have, even after you put on medication, a patient will walk into my office and say, Doc, I feel fine, so I stopped my medication 3 months ago. So that is a common thing. I feel fine, so I don't need my medication anymore. And commonly what we like to explain to patients is that the reason why you feel fine and why your blood pressures are normal is because your medication is working. And if your medication is working and you cease that medication without medical advice and supervision, you could put yourself at a lot of harm.
But do you think that you can, I don't know, based on how bad the pressure is, can you bring yourself out of medication maybe a year by changing your lifestyle?
Lifestyle change is critical, as you mentioned. That will give you the highest rate of success in really changing your risk factors. Because the reason why we treat high blood pressure is the propensity for catastrophic changes in the body, such as kidney disease, strokes, even major heart attacks. Also, patients can be predisposed to vision loss through strokes as well, that could target the vessels that supply the eyes. So it's pretty important, and this is the reason why high blood pressure control is so something that we need education on. Because all of those elements that we mentioned, in addition to the fact that lifestyle modification is key, some people say, another one, I'm on medication so I can eat what I want.
Correct. Right.
I'm treating my high blood pressure so I can eat whatever I please.
Yes.
And that is just counterintuitive. It doesn't provide you with the best chance of minimizing your stroke risk, your heart attack risk, even your kidney disease risk. So having that element under control is key by understanding a plan that works for you and really employing that every day.
Yeah, I think as you mentioned there, and I've heard that line before.
Yes.
Doc, medication,
what I want.
Yes, I heard that before, yes. and I guess that's a bit as well, because you're not really helping the condition. You're actually just maintaining, not exactly. And I think our culture, most of us like that because diabetes is very high, and I think people rather be comfortable in taking a pill than changing their diet. That's what I bounce up out there. And I think, again, what we're lacking here is what you said earlier on, which is lack of information, how to deal with, diseases and lifestyle changes like that, right? Because most people just want to change their diet. When they go to the doctor, you get them the story, you have to take these pills, especially men, right? Because there's also, maybe a myth again, where these blood pressure tablets have side effect on men. I don't know what it is, I'm just saying, I hope I had learn that the hard way. But is it true? Some medication could have some side effects, negative side effects on.
Most of the medications will carry side effects of different categories. So that's why it's important. Some persons will, for example, visit the pharmacy, and because their mom is taking one particular pill, they will go and take the same medication.
Yeah.
They say, Mommy is taking that, so I will take it as well. I have a friend who's taking this, so I will take it as well.
Yeah.
But what I try to help patients understand and educate them on is that those medications are usually patient and situation specific.
Correct.
So this is why you minimize the side effect risk and also minimize the harm to yourself by having a drug that really is tailored towards one, your hypertensive goals, the goals that we are trying to achieve, the degree of hypertension that you are at, and the stage, in addition to your lifestyle and what are your risk factors, because remember, all of those things need management. So stopping on a medication is only one element. It is the same way the disease process is multifactorial, it's the same way that you will need guidance on which medication is best suited for you to avoid adverse effects.
Yeah, well, I think that is the correct way that you're saying, and you should know as doctor yourself. But I think in reality, hence the reason why people wait till last minute to check the doctor is because they always believe that I know. We have this, our culture is like, I know, as you rightly said, my brother or my sister, my mother taking this medication for high blood pressure. You know what?
So I
will just take it too, without seeing the doctor.
Correct.
Right? I mean, we only go by the doctor if we realize something drastic happened. So again, I think our culture is really suffering from, information, and high blood pressure is just one of it, but all the lifestyle diseases, I think that's why the percentage of high blood pressure and diabetes is so high in this country.
Exactly.
Right? So you know, what the message that we given out there to the people that Weiss is about high blood pressure, but the actual knowledge or the information or the advice you want to give out there to people coming to their health, what would you say to them now, going forward? Is it, you know, regular checkup? You know, I think that should be the first outside of, you know, tweaking what you eat, changing your lifestyle, because it's different for some. Because some people might say, you know what, I may not eat, some people eat too much fruits and it raises the blood sugar or whatever. So it's critical to me, I could be wrong, correct me, to check with your physician to make sure that eating 4 apples a day in raising your diabetes or whatever the case is. So it boils down to regular checks.
Exactly.
So Doc, what are some of the take-home points for us to tell the viewers when coming to high blood pressure in the everyday life?
Right. So some things I would leave with our audience would be this. Now, do not wait till you feel unwell or things are severe to visit a medical professional. In the same way that you would take your car to service, what is it? Every term? Every 3 months?
Yeah.
Right. This is where you need to be. You need to be at your physician's desk, right? Servicing almost every 3 months, 3 to 4 months. Once guarded that everything is normal, you'll be guided accordingly. However, you can't take it for granted that everything is completely normal because your blood pressure can be high and you feel fine. Quick story before I close. My dad's blood pressure was 200 on 160, and he was perfectly fine.
Wow.
Until sometime till it progressed. So he is used to measuring his blood pressure. So he picked it up very early and prevented a catastrophic event. So this is one of the take-home messages I'd like people to understand. The reason why he was able to do so well with a blood pressure that high, well in terms of not suffering from a stroke or heart attack, was because he was an athlete.
Oh.
So that ties into maintaining a regular healthy lifestyle, an active lifestyle, and eating healthy as well. So I would say focus on your lifestyle, avoid smoking and alcohol as much as you can, minimize your salt intake, and also check your medical professional for at least an annual check, even if you feel well and you don't think anything is wrong. That would be the take home.
Right, so yeah. Right, so come down, 130, Eastern Main Road,
Yes.
Sawa, opposite Furniture Plus.
Correct.
Make
Yes.
medical your go-to physician, just so you go by your service center for your vehicle every 3 months, check yourself, because
Yes.
your vehicle more important than our body.
Exactly.
Right? So that's my message to you from this medical institution. Yes?
Yes.
So take care.
Yes. Thank you so much for tuning in. See you next time.